Okay, hi everyone. Thanks so much for joining us this evening. My name is Candace Rennick. I'm the Secretary Treasurer of CUPE Ontario. I'll be moderating the Zoom webinar this evening. We are just going to wait a few seconds before we get started, giving folks an opportunity to log on and join the call. We have hundreds of people registered tonight, and I can see the numbers are rising. People are coming on as I speak. So just a little bit of information that may be useful for you. If you prefer to listen to the webinar this evening in French, you can go to the globe icon, which is located at the bottom of the Zoom screen, and you can select French. That will allow for simultaneous translation to be coming through your feed, and it will provide you translation for the entire call. If you prefer to listen in English, you can click English. This evening, you will be able to interact during the session by using the Q&A feature. The Q&A feature is found at the bottom of the screen. If you ask a question using the Q&A feature, we will not attribute names to the questions that are asked. We will simply just read them out, and they will be from anonymous folks. We will not be acknowledging any raised hands, and the only way for you to interact with the Q&A tonight is through, or with the webinar tonight is through the Q&A feature. So just because we've had dozens of people join in the couple seconds that I've said that, I'm just going to repeat it. If you have or you require French translation tonight, you can use the globe located at the bottom of the screen. You will click on the globe and click French. That will ensure that you have simultaneous translation throughout the entire event. If you want to ask a question this evening, the only way that you're able to interact with the webinar this evening is through the Q&A feature that is also found at the bottom of the screen. You can type your question into the Q&A feature, and when we get to the Q&A session, we will select questions and read your question, and we won't be attributing names to any of the questions. We will just simply read them out. As a reminder, we will not be recognizing any raised hands, so please don't raise your hand if you have a question. I won't see it. The only thing that we'll be paying attention to this evening is the Q&A feature. We're really super excited to get started tonight, so I think without further ado, we are ready. I'm going to turn it over to Fred Hahn, the President of CUPE Ontario. Go ahead, Fred.
Thanks so much for that, Candace. And thanks to all of you for being here. I am Fred Hahn. I am the President of CUPE Ontario. I'm zooming in from the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. It's important that we do these recognitions because they help us to not only remind ourselves of the history of the land on which we work and live, but it also connects us to our responsibility to work together toward reconciliation with Indigenous people. We are, after all treaty people. We're joined this evening by our moderator, Candace Rennick, who is the CUPE Ontario Secretary Treasurer, CUPE National Health and Safety Representative, Paul Silvestre, Goldblatt Partners lawyer, Daniel Shepard, and infectious disease expert, Dr. Tara Moriarty, and CUPE long-term care members like you from across the province. This call is specifically for leaders in our long-term care sector of our union. And I want to start by saying thank you to you all on behalf of all of our members, those in other sectors of CUPE, and those in communities across the province for the work you and your members have been doing for the last 18 months since the COVID-19 pandemic changed our entire world. Workers in long-term care have been the first and last line of defense for our loved ones in long-term care. And as leaders, most of you have been working frontline as well as supporting other members in your local during a very stressful year and a half. It's been very hard. And the extra duty that you take on as leaders means a great deal, not just to the members in your workplace, but to our entire union. We're here tonight to talk about vaccine policies specifically in the long-term care sector. We're contending with employer vaccination policies of all types across all the different sectors of our union, But with the government's recent announcement in long-term care is currently the only sector in Ontario with a mandatory vaccination policy that will ultimately prohibit workers who are not vaccinated from going to their workplaces across the province. We'll be discussing that policy and the other implications that it has in workplaces tonight and what it could ultimately mean for CUPE members. Our union, of course, will do what it always does, not just present you with thanks and gratitude, but try to provide you the very best information we have and the best representation we can provide to understand what's currently happening, both with the initiatives from government and policies in your workplace. I do want to remind you that our union from the beginning of this has been saying very consistently the same thing about vaccination, that vaccinations are both safe and effective, and that everyone who can be vaccinated should be vaccinated. The vast majority of our members are vaccinated across all of our sectors and workplaces, but we know that not every member is. We want to also listen to those who may be hesitant, and we will defend the rights of those who may be exempt. I want to underscore that this is a safe space for all of us. It's a place where questions can come forward for those of you who have them without fear or ridicule or retribution. Our union is here for our members, for each of us, all of us together, now and always. It is how we will get through this and how we've gotten through everything, by being together. Now, I'm going to turn things over to Candace. Candace, go ahead.
Okay, thanks so much, Fred. This is a really important town hall on an issue that has understandably attracted controversy. So as I said at the beginning of the call tonight, for those of you who are just joining, if you have questions or comments at any time, please put them in the Q&A feature located at the bottom of the Zoom screen. And we will not be attributing names to any of the questions. We will simply just ask the questions. This evening, we will refer to helpful resources from CUPE National and elsewhere. They will be made available for your information at cupe.on.ca/vaccine policy info. I'll ask one of our staff to put that in the chat for you folks. And tonight's town hall is being recorded. And so if your members are not able to join this evening and you want to share this information with your members, you will be able to access a link after the call. So I want to begin with an overview of recent events. On October the 1st, the Ontario Minister of Long-Term Care announced that as of November 15th, staff, students, volunteers, and contractors, except those with medical exemptions, will not be able to enter a long-term care facility if they are not fully vaccinated. They've done this by amending an already existing directive from the Minister of Long-Term Care that required homes to have vaccination policies in place. The previous directive stated that those policies had to include provisions that staff provide proof of vaccination, proof of a medical exemption, or attend an educational session. With these new changes, homes are required to have policies that make vaccination mandatory and that do not allow staff who are not fully vaccinated and do not have a medical exemption to be able to enter the facility to work as of November the 15th. The directive leaves it up to individual homes to determine what the consequence will be for staff who do not meet these requirements. While this announcement makes some things clearer, we're still left to assess each home's policy individually. And that assessment is still rooted in the same principles that we've discussed on previous calls and that we're going to discuss in detail here this evening. We should note that at the same time, the minister also announced a change to the surveillance testing requirements that requires homes, starting October 15th, to do random testing of fully vaccinated staff. How that occurs is being left up to individual homes, and we would encourage locals to discuss with your staff rep and the employer to determine what this testing will look like in your home. I'm first going to turn it over to our CUPE National Health and Safety Representative, Paul Sylvester, to make a very brief health and safety presentation. Please go ahead, Paul.
Thank you, Candace. Hello, everyone. I'm going to give a quick, I know you have some questions, but I'd like to just quickly go over the health and safety aspect, because while vaccines have been helpful in reducing cases and outbreaks in homes, it's important that in the next few months that workplace safety is maintained. As many of you know, the Directive 3 requires homes to conduct organizational risk assessments, ensure they're ongoing, and develop COVID-19 preparedness plans in consultation with your Joint Health and Safety Committee. Now, even though cases aren't like we saw last year, we're headed into a fall or an autumn season where we just, the risk of combined flu and coronavirus is too worrisome to just wait and see. So it is important not to let our guard down. There is some guidance material from the Ministry of Long-Term Care that sets out how homes should prepare for the fall. Some of those important items include like having an outbreak management team, which must include worker input, and that it considers occupational health and safety. And while resident safety is certainly at an utmost, we want to ensure that IPAC programs do not lose the focus on worker safety as well. So the review the current IPAC programs for COVID-19 and influenza for outbreak and non-outbreak situations, ensure that there's a strong workplace safety component. And address any issues that you may have experienced in the past with cohorting residents and staff. We heard a lot of concern that homes weren't able to completely reduce their exposure points because of cohorting problems. Those kind of logistical issues should be worked out in case of a surge in either flu or for COVID-19 outbreaks. And part of that ensures also that PPE is available in appropriate stocks, and it's unexpired equipment. Many homes use what's called a burn rate calculator to determine how much PPE they're going to need for surge capacity and for outbreaks. So do they know for small or large outbreaks how much PPE they're going to require? And do workers have access to, do they have unfettered access to the PPE, as Directive 5 sets out? And those, it's important that we haven't really mentioned respirators in a long time, but it is still homes that have at least one case is sufficient for workers to demand respirators, and ensure that if you haven't been fit tested in the last 2 years, that you get fit tested to ensure that the respirator model that you're assigned to still is a tight seal to the face. Ensure that training on any kind of IPAC program is provided to staff and volunteers. And training does not mean sitting in front of a computer or reading a policy. It's engaging with people, letting them ask questions, and be available to answer any feedback from workers. It's good to ask if you're on a Joint Health and Safety Committee, or ask your employer, if you're a local executive, is if your home has a contingency plan for staff shortages caused by illness, and does it have a contingency plan if there are planned either layoffs or hopefully not terminations that might happen as a result of vaccine policies. And these contingency plans should not consider that longer hours or overtime is a long-term solution. Overtime and long hours, even though they're common for the sector, it sometimes is relied too much on as a problem, as to solve the problem for short staffing. Ensure that staff is kept up to breast and up to speed on outbreaks that are happening within the home, and that ongoing communication between shifts is happening. And it's a good thing to beef up your influenza plans, even though there wasn't a very strong flu season last year. It's time to dust off those flu plans and compare it to your COVID-19 plans, where there are perhaps less things that are less safe, or some measures that don't equal some of the stronger COVID-19 measures and procedures is to ensure that they go to the highest possible measure and procedure and not be limited to just because it's written in a flu policy that might be weaker. So ventilation, ensure that your ventilation system is inspected at least every 6 months as required by the healthcare and residential regulations. There is also an additional checklist that Public Health Ontario has developed to assess your COVID-19 program. And we can have that, the guidance document that I spoke about earlier from long-term care and the PHO document have been put in the chat. And as always, please visit qp.ca/health and safety for COVID-19 information around variants, ventilations, and assessments. And also there is a QP vaccine FAQ that was developed last spring, which still contains lots of important information on how vaccines work and how they're important. So thank you. And I'll be happy to answer any questions that you might have. Back to you, Candace.
Okay, thank you so much, Paul. We're now going to hear from Daniel Shepard, a lawyer from Goldblatt Partners, who's here to speak with us this evening about the legal issues concerning this policy and others. So please go ahead, Daniel.
Thanks, Candace. And thanks everyone for coming out tonight. So I'm here to answer any and all questions you may have about the legal aspects that are involved with mandatory vaccination, particularly in the long-term care sector. I've been one of the lawyers that's been following all of the legal consequences from COVID quite closely. And for those of you who may have been on previous QP webinars and town halls, you may have heard me talk about these topics as well. I don't think I have much to say by way of a presentation. I really think that my value here is in answering the questions that you have. And so I want to make sure most of the time is reserved for that. But maybe I'll just tell you where I come from when I come to these conversations, what my perspective is. And it's fundamentally this. Many of you are going to, in the days and weeks to come, be facing an important choice. You're going to be facing important choices with respect to whether or not to become vaccinated. You're going to be facing important choices about whether or not to disclose your vaccine status to your employer. And it's only fair that you have an understanding of what the consequences of those choices are. I'm not here to tell you what are good or bad choices to make. I'm not here to tell you what is or is not fair. What I am here to do is to give you the best information I have about what the law says in this area, and therefore what consequences you may face depending on the choice you made. Sometimes I can be able to tell you that with a high degree of certainty. Sometimes I am confident what the answers to your questions are. But there's going to be other times in which I'm less confident. This is still a new issue. There is still a lot of law that has to be made, a lot of questions that haven't been decided yet. And so often there's going to be questions that you may have where I'm not going to be able to tell you with any degree of certainty what the outcome is going to be. What I'll do is try to do my best to tell you what I think the answer is and how confident I am in that answer, so that when you are then forced to make those choices for yourself that are going to have some pretty important consequences for you, you will be able to do so with open eyes. In terms of the general background in long-term care, Candace has already really given you a good overview of that in terms of the recent changes that came in, with the minister's directive, as well as the changes that have taken place with respect to surveillance testing for both vaccinated and unvaccinated staff. So I don't think I need to review that. Although again, if there's any questions about exactly how those rules work, I would be more than happy to discuss those. But otherwise, again, I'm just really grateful for the opportunity to speak with everyone here tonight and to answer whatever legal questions you may have about the issues that are going to be facing you in the days and weeks to come.
Thank you so much, Dan. And we do have the questions rolling in. So as soon as we hear from our next and final speaker, just want to make sure that Dr. Tara Moriarty is available for us. She was in transit. So just want to check in. Tara, are you able to come on the line? Yes, you are. Okay, great. So it is a pleasure for me to welcome Dr. Tara Moriarty, who is a infection disease scientist at the University of Toronto. here just to say a few words to us before we get into the Q&As that you're posing in the Q&A section. Over to you, Tara. Tara, can you hear me?
Yes. I'm very sorry. I was just in transit on my way home. All right, so like here, I'm not here to tell you what the best, can you hear me?
It's a little sketchy, but you are coming in a little bit clearer than you were at the beginning, so go ahead.
Okay, sorry, there was quite a delay there. I'm not here to tell you what decisions to make either, but to provide a resource. You can talk to me about any questions you might have about the vaccines. I will tell you what the current best scientific knowledge is about the vaccines, about anything associated with vaccination. Like Dan, I will tell you when there are uncertainties and when we know things with quite a bit of certainty and confidence. But I'm not actually going to talk about the vaccines or all of that. Really, I'm here to answer questions. And I wanted to let you know that I'm part of an organization of volunteer scientists, doctors, and pharmacists who answer questions all the time. We do evening drop-in sessions for anyone who wants to come and ask questions anonymously without someone else knowing. We never judge. We hear every question over and over again, and we understand that these are difficult decisions for people. So we're there to provide support. I'll provide a link for that in a moment. And starting in a couple of weeks, for those of you who may be representing members in homes or supporting members in homes, we're also starting kind of sort of an ambassador training program where we will help train people to have these difficult conversations with people in their community, whether that's family, friends, co-workers, and others. And that program will be available starting in a couple of weeks. If any of you are interested in it, we'll provide that information to you as well, because these conversations are very, very difficult. And what is most important is that we don't undermine trust in each other, and that we don't cause fragmentation of society, and that we don't drive people away on any side of the issue who are good people and who care a lot about the people they care for in their workplace. And so it's very important to have these conversations in a way that is supportive. So I'm going to drop a link in the chat for everyone that lets you get to the vaccine Q&A sessions, and then I will just zip it and answer any questions you may have.
Okay, great. Well, you know what, Tara, why don't we start with you, because there's lots of questions coming in. I mean, lots of questions for Dan, which we're going to get to in a second, but lots of questions coming in from people saying, this is still in clinical trials. This isn't safe. We don't feel safe. Why is this being forced on us if we're not safe or feel comfortable taking it? How would you respond to that? Yes, well, it's a very common, it's something that we hear a lot. And in fact, the vaccines are out of clinical trials. They have been approved for use in many countries in the world by many regulatory agencies, including the Canadian one. And what happens is that most medications, after they go through the trials, go into an early phase when they're available on the market, where there is enhanced reporting that is still happening and enhanced scrutiny. And that is what these vaccines have been going through since January. But now, for example, the Pfizer vaccine has passed that phase as well. So all of these vaccines are being closely monitored. And if it helps, you know, I don't know how many of you remember when AstraZeneca was paused, for example, in Canada, while they were looking at possibility of various problems.
There have been changes in the recommendations about who gets the mRNA vaccines because of myocarditis. What you're seeing is these regulatory agencies being extremely cautious and extremely careful with these recommendations. So the conditions that cause these to be paused, or the people for whom these vaccines are recommended to be changed, are extraordinarily rare. Both myocarditis and clotting issues, for example, are thousands of times more common in COVID than they are following vaccination. But because you have to be sure that you're not causing harm in a population that might be more susceptible to it, those pauses were put in place. And that's an example of regulatory agencies doing what they need to do. And that's something that most of us don't see on a day-to-day basis unless we work in that area, because it's not in the media every single day. But all of us have viewed this and seen this information and see this process work out since the beginning. And what you're seeing is that regulatory framework in place. And so all I can say is they're not experimental. These vaccines have now been used in combinations of these vaccines have been used in 40% of the world's population so far. And we have more data about the safety of these vaccines than we've ever had about pretty much any vaccine in history. So we do know a lot about them, and they are not in clinical trials still.
Thank you very much. We're going to move to a question for Dan. Several questions in the chat are asking about whether or not people who opt to not be vaccinated and who are at risk of losing their job, what will their sort of walking papers say, and are people entitled to severance pay?
So there's probably not going to be one answer that applies to every workplace. What the government directive says, and I'll preface this by saying, is that you have to pay attention to two different things. There's the government directive on the one hand, and then there's your individual employer's policy on the other. The government directive that requires long-term care homes to come up with these vaccination policies only lists one consequence for not becoming vaccinated. And that one consequence is an unvaccinated worker is not allowed to enter the workplace in order to perform work. There's some exceptions to that, but that's the general rule. It doesn't say what else happens. The only other thing that the government directive says is that, hey, employers, you have to tell your workers what's going to happen. You have to tell them clearly, but it's up to you to decide what are the other consequences. So in terms of what those other consequences are, it may vary between different long-term care homes. They may impose different consequences. Theoretically, although I'm very certain that there aren't going to be many, if any, homes doing this, theoretically, they could say, well, we'll just continue to pay you and you can just sit at home and get full salary. That's not realistic. That's not what employers are going to be doing. But there's still going to be a range of things. They could also say, well, you're going to be sitting at home on an indefinite unpaid leave of absence, and you're not getting fired. You're just not getting paid and you're not coming to work. And on the far end of the spectrum, there's going to be some employers we suspect, and in fact, I believe there are some now who are saying you're terminated. So in terms of what your papers are going to say, I don't know, because I would need to know the specific policy that's written for your workplace. And so that would be the first place you should look to in order to determine what exactly is going to happen to you. In terms of severance, if you are a worker who's placed on an unpaid leave of absence, your employment relationship isn't being severed unless you have specific collective agreement language that deals with durations of leaves of absence over a certain period of time. And again, that'll be different from workplace to workplace. But if there's no language there, or if you're just allowed to be on an indefinite leave of absence, you're not going to get papers because you're not fired. You're still employed. You're just not doing work, and so you're not getting paid. For those individuals whose employment ends, there's actually a couple of different ways that can happen. Some employers may say you're being terminated for cause. In other words, they're saying your refusal to be vaccinated is misconduct. It's bad, and so we're firing you for being a bad employee. For those individuals, your paperwork is going to be saying you're terminated for cause, and you would not normally be entitled to severance under those circumstances. That can be challenged, but the reality you would be facing for the immediate future is that no, you would not be entitled to severance. On the other hand, it's theoretically possible, although again, I don't believe many employers would do this. They could say that they're engaging what's called a non-culpable termination. So we're releasing you from the employment relationship. It's not really your fault. It's beyond your control, but you just can't do the job anymore. And so you no longer work here. And in those cases, the case for getting severance pay may be higher. The bottom line is that unless I know the specific policy that applies in your workplace, and unless I know the specific collective agreement language that you're operating under, I can't give you a specific answer to that question. What I can tell you is that I think for the majority of you, you're going to either be on an unpaid leave of absence, in which case you're not getting paperwork at all, or you're going to be terminated for cause, in which case your paperwork is going to say we fired you because you engaged in misconduct and you're not entitled to severance pay under those circumstances.
Thank you so much. One of the members says to us, read the charter. This is a violation of all human rights. It's our given right to refuse any medical experiment, and by putting us on an unpaid leave, you are refusing us the right to work.
I mean, fantastic question. And I could probably take the rest of the seminar tonight unpacking all of the legal issues that arise from that. I'm not going to do that, but let me try to give you kind of the high level summary of how I would think through those concerns as a lawyer. So you've talked about two things, actually. You've talked about the charter and you've talked about human rights, which in Ontario, there's something called the Human Rights Code. Starting with the charter, some of the employers in the long-term care sector will have to comply with the charter, but a lot of them don't. The Canadian Charter of Rights and Freedoms only applies to the government. So for those long-term care homes that are municipally operated, they would be required to comply with the charter because they are considered to be part of the government, really technically at the provincial level. So if you're in a municipal long-term care home, then the charter applies to your employer. But if you're not in a municipally operated long-term care home, the employer doesn't have to comply with the charter because the charter doesn't apply to them in the first place. The charter does not apply to private actors. It doesn't apply to me. It doesn't apply to anyone you're seeing on your computer screen right now. And it doesn't apply to long-term care homes unless they are part of the government itself. So if you're in the private sector, it doesn't matter. Charter doesn't apply in the first place. When it then comes to those places where the charter does apply, then you have to ask the question, well, doesn't the charter give us the right to make personal choices about what health procedures, what medical procedures we subject ourselves to? And the answer to that is yes, it does. Section 7 of the charter guarantees the right to life, liberty, and security of the person, and the right not to be deprived thereof except in accordance with the principles of fundamental justice. It is a very complicated, very misunderstood part of the Constitution. But I think it's fair to say that in general, it would support a claim that an individual does have the right to make decisions about what medical procedures to undertake for themselves. But the real question, and the really practical question you're going to be facing is, okay, well, is anything in the long-term care sector with respect to vaccine mandates contravening that rule? And the answer is labor arbitrators, who are going to be the decision makers who are going to decide that question, are going to say no. And they are almost certainly going to say no. And the reason why I say they're almost going to certainly say no is that for the last 30 years, they've been answering that exact question by saying no in the context of influenza vaccination policies. So I said at the beginning of this, this is a new issue. There's a lot we don't know yet. There haven't been any court cases or arbitration cases about COVID vaccination policies in Canada. There have been quite a few in the United States, and I should let you know, in every case, those vaccination policies have been upheld by the courts as constitutional, but that's the United States. In Canada, what we look to are the flu vaccine cases because they're the closest that we have to the current situation we're facing. And in those cases, there were employers, primarily in hospitals and long-term care, that required employees to be vaccinated against the flu, or else they would be put on an unpaid leave of absence during flu outbreaks. And many workers in those cases raised arguments that are really, of the kind that Candace just articulated, right? You're forcing me to get vaccinated. The Constitution says I'm allowed to make these choices for myself. You can't do that. And arbitrators, with only one exception that has never been followed, so 99.9% of all cases that have considered that question have said, no, you're not being forced to become vaccinated. You're being given a choice. You can choose to become vaccinated, or you can choose not to become vaccinated. And that is your choice to make, and no one is telling you how to make that choice. But like almost every other choice you're going to make in your life, that choice is going to carry with it consequences. And the fact that some of those consequences are pretty severe doesn't mean you don't have a choice. It means you have a bad choice. It means you're in a really difficult place and you're faced with a choice that you don't want to make, but it's still your choice. And so if we look at those cases and try to use that to think, well, how are labor arbitrators going to decide COVID vaccination cases? I think the general view is that arbitrators are going to say the same thing, which is you're going to make a choice. The employer is not forcing you to become vaccinated. They are not holding you down and injecting you with the drug while you scream, no, no, I do not consent. They're saying you can become vaccinated. And if you become vaccinated, here's what's going to happen. You get to continue coming to work. You're going to be subject to random antigen screening. Or you can make the choice not to become vaccinated. And if you make that choice, here's what's going to happen to you. You don't get to come to work. You're not going to get paid. You may be fired. That may sound really inauthentic to people. That may sound profoundly unfair. That may sound like it's not really a choice. And I sympathize with that perspective. But the reality is that is what labor arbitrators have accepted over the last 30 years when it comes to these issues, and have said that it's still your choice to make. Things may be a little bit different in COVID, but the differences in COVID cut both ways. So on the one hand, in COVID, we're dealing with people being on leaves of absence or for much longer periods of time. Flu cases, you're usually looking at about 2 weeks being off work. Here, we don't know how long it's going to be. It could be months. Or they could be terminating people, which is something that didn't happen in the flu cases. So that may be different. And that may lead an arbitrator to look at these cases differently. But you also have to recognize that arbitrators who have looked at COVID issues have unanimously, without any exception, said that COVID is far more serious than flu. COVID is a once in a generation health crisis that really justifies some more extraordinary measures on the parts of employers. And when you look at it that way, they're going to be more inclined to allow employers to take more extreme measures to encourage vaccination. So what's the bottom line? What's the takeaway for you? Well, the takeaway for you is that no matter what you think is right or wrong, whether you think I'm telling you some really good advice or you think I'm full of crap and you shouldn't pay attention to anything I say, the reality is that if you choose not to vaccinate, your employers are going to place you on an unpaid leave of absence or terminate you. And that's something you're going to have to live with for quite some time, even if a grievance goes forward to challenge that. And so you just have to understand that when making that choice. It's a difficult choice, but that's the choice you're facing. And then as you're evaluating your chances of being successful at the conclusion of your grievance, you should understand that arbitrators have said, at least when it comes to placing people off of work for 2 to 3 weeks at a time, that is not in any way undermining their right to make a choice. That is something that employers are allowed to do. It doesn't violate the Constitution. It doesn't violate human rights codes. It is what's called a reasonable exercise of management rights. In the context of long-term care, they have to do it because the government has ordered them to do it. So those are the things I would be thinking about primarily when I'm thinking about, well, doesn't this violate my right to make choices about my own healthcare?
Okay, thanks, Dan. Take a little break just for a second, coming back to you very shortly. 2 things. One, no, CUPE does not have shares in Pfizer. I can guarantee you that. We also have a large pension plan, and I can assure you as a pension trustee that our pension plan also does not invest in pharmaceuticals, including Pfizer. So the question about whether or not CUPE has shares in Pfizer, absolutely inaccurate. Dr. Tara, many women saying, I'm pregnant. Is it safe for me as a pregnant woman? Am I entitled to a medical exemption because I am pregnant?
That's a really, really good question. And this is a case where I would say run, don't walk to be vaccinated, because pregnant women are at a significantly greater risk of severe COVID and are significantly greater risk of preterm birth and other complications for their babies if they contract COVID. I'm not sure how many people have seen some of the stories, for example, out west right now in Alberta, where there are a lot of younger people with severe COVID, and there have been some pretty tough stories about pregnant women who have died or had their babies delivered by C-section while they were unconscious. So what I would say to you is that every major Society of Obstetricians and Gynecologists in Canada, the US, the UK, have all said that not only are these vaccines safe for pregnant women, but they would strongly advocate that pregnant women be vaccinated for their own safety and the safety of their child. And so in that sense, I would actually say, to protect yourself and your baby, please consider doing it. If you have any worries about it at all, come to our vaccine Q&A sessions. We will answer every single question. You can be anonymous. Anything you've ever heard that you're worried about, come and see us. It's really important to have a healthy baby. We understand that, and we know why there's so much fear. And a lot of our volunteers or moms themselves have been pregnant while vaccinated. So they also understand what this feels like. And we're there to answer those questions. But the vaccines are safe for pregnant women and their babies. And in fact, they provide substantial protection compared to COVID.
Thank you very much. What about the employer's duty to accommodate up to undue hardship? This individual is under the impression that most long-term care positions cannot be done remotely, and therefore unwillingness to be vaccinated would result in termination regardless of medical or religious exemptions. Dan?
Yeah, so that's a good question. So the background to this is that the Human Rights Code does provide individuals freedom from discrimination in employment matters. It's important to understand that discrimination doesn't just mean unfair treatment or treating people differently. It means drawing distinctions based on specific listed grounds. Disability and creed, which commonly means religion, are two of those listed grounds. It's also important to recognize that vaccine status, or whether or not you've been vaccinated, is not one of the grounds. And so treating people differently based on whether or not they're vaccinated does not violate the Human Rights Code. For those individuals who have a medical or creed-based reason why they can't become vaccinated, they are entitled to accommodation by their employer, but only, as the question asked, up to the point of undue hardship. So they have to accommodate you, and they have to go through quite a lot of hardship in order to accommodate you. There just becomes a certain point in which that hardship becomes undue. And as the question kind of noted, you know, in long-term care, you can't really do your work from home. And I mean, I accept that. I intuitively believe that is true for the overwhelming majority of long-term care sector workers. So the question is, well, then what does accommodation look like in these circumstances? And there's no one-size-fits-all answer. Accommodation under the Human Rights Code is fundamentally an individualized process. It depends on the specific needs of the individual worker, which is going to be different for every single worker. It's going to depend on that worker's job duties, their job functions. It's going to depend on their workplace, you know, the physical setup of the space that they work in that may be different than one of their colleagues who works in the same building. So it's going to be different for everyone. So I can't tell you exactly what's going to happen or when you get to the point of undue hardship. What I can tell you are what are some of the possibilities we might face. And these are possibilities that I'm kind of thinking of based on the government's recent October order. And I'm also looking back at case law about influenza vaccine policies, which also dealt a lot with this accommodation question. So sometimes they talk about modified job duties as one possibility. So making an individual, changing their job functions so they don't interact with an individual who is going to be vulnerable. So working in a place that doesn't have direct patient contact, for example, may be something that an employer can do. Under the order that's been made by the government, unvaccinated workers are allowed to go into the workplace and work and be paid for it. So your reasonable accommodation may be go into the long-term care home and continue to work. However, have modified job duties, be subject to more frequent antigen and PCR testing regimes, which is something that would be required under the order about screening. Enhanced PPE, maybe something that you face. So all sorts of things can be changed about how you do your job and what you're going to be subjected to, but you may still be allowed to work. Another form of accommodation that came up quite frequently in the flu vaccine cases is that workers were placed on a paid leave of absence. So they were told to stay home, don't come into the workplace, but they would still get paid. I think that's much less likely in long-term care. And that's because in the COVID context, we're probably looking at months, not weeks, like we did in the flu vaccine context. So it wasn't going to be undue hardship for an employer to pay for a worker, for 2 weeks of a paid leave of absence because they were allergic to a flu vaccine. Here, if a worker is allergic to a COVID vaccine, they may be off for 6 months. The requirement to pay for a worker for 6 months for not doing any work at all may be undue hardship for the employer. I'm not saying it is or it isn't. I'm saying that there's going to be a stronger argument that it's undue hardship. And so it's going to be less likely, I think, that we're going to see those kinds of accommodations. The message I would give everyone is that, if you are entitled to an accommodation, don't let this notion of undue hardship make you think, oh my God, they're just going to be able to fire me anyway. If you believe you have a proper ground for accommodation, you should be talking to your local and you should be pursuing an accommodation request. The employer has an obligation to work with you and to work with your union to explore accommodation possibilities and to seek out creative solutions. Saying we can't do anything to help, that's undue hardship, is the absolute last resort. And any employer who just straight up said, sorry, you're not vaccinated, there's nothing we can do for you, really is putting themselves at risk of being found to be in violation of the Human Rights Code. So I can't say what anyone's accommodation is going to look like, but what I can say is don't be afraid to pursue accommodations if you have a medical condition or a creed that would entitle you under the law to reasonable accommodation by the employer.
Fred, some members are saying, and we know this, some of these workers who are opting not to be vaccinated have been working on the front lines of long-term care facilities for 30 years. Is CUPE going to step up and defend and represent members who are choosing not to be vaccinated and as a result are terminated?
Thanks for that. I'll try and be pithy. Termination is the highest form of discipline. Of course, we're going to try and represent you. And of course, we'll do our best to do that. We owe nothing less to any worker, honestly, and certainly people who've been working for 30 years, giving their adult lives to this incredibly difficult and important work. But part of what this is about tonight is making sure you all have as much information as possible. And any of you who've been more involved in our union will know that we can file grievances on all kinds of things, but we aren't guaranteed an outcome in relation to what happens with those grievances. So I'll be short again. People get terminated, we're asking locals to file grievances for that. But if and when we do that, and when we go through a process, I think you've heard this before from Dan and from other lawyers and probably from your national staff rep assigned, we can't know what will happen to that grievance. We can't know whether or not people will be successful in gaining back employment that they've been doing for 30 years. We can't know what risks people put themselves in that regard. It's part of why we're doing two things at once. We're trying to allow people to ask questions about why it is they still have concerns about being vaccinated, but also being really clear with them. That's your choice. You get to make it. And we will do our duty as a union for our members. But we're in a global pandemic. This is not like anything we've been through before. While we can and should rely on what has been there in the case law, like how this is going to be handled, we don't know. So will we defend our members? Yes. What will happen with that? We don't know. And really, what we're also trying to do is remind folks that there's still time. If there are still things that might make people feel differently about their choice, it is your choice. I'm not telling you what choice to make.
So Dan, if QP doesn't represent me or get me my job back if I'm fired, can I sue them or take them to court?
I don't give advice to individual workers taking action against their unions. You should be aware that your union does owe you a duty of fair representation. That does not necessarily mean that they have to do anything that you ask them to do. They have a duty to take your concerns seriously and to not treat you with discrimination or to treat you in an arbitrary manner. Individuals who feel as though their unions have not fairly represented them, I would encourage them to go seek out legal advice from a lawyer who specializes in representing unionized workers who have disputes with their labor unions. It's an important right that every unionized worker has, and no union member should ever be denied their right to raise concerns about fair representation issues from their representation.
An employer is threatening nurses that if they are terminated because of not getting the vaccine, they're also going to be reported to the College of Nurses. Does that mean that we're no longer able to practice as a registered nurse?
Yeah, so this is an issue that's kind of recently come up, and I know that it's also becoming an increasing issue in Quebec, where their regulatory college has taken a fairly strong stance in this area. So I need to be a little bit careful in answering this one because I'm not in a position to advise any regulated health professionals about their professional obligations. So I can't give you an opinion. At least in this context, on whether or not a refusal to vaccinate would, for example, constitute professional misconduct under the Nursing Act or would be an offense under the Health Professions Procedural Code. So I have no view on what the merits of that would be. But let me talk to you about the risk of that happening. So we know in Quebec that the nurses regulator there has taken the position that they will be suspending nurses who do not become vaccinated. I have not heard the College of Nurses of Ontario taking any similar position. They have not come out and said that they're going to be proactively taking any enforcement action against health professionals based on their vaccine status. Employers who are threatening to report staff members to the college, the basic answer is yes. They can report you to the college. Anyone can report any nurse to the college about anything. I could report a nurse to the college because I think that they're an invader from outer space and so shouldn't be allowed to practice nursing in Ontario. The question is, what's the college going to do with that information? And at this stage, we don't know because to the best of my knowledge, those complaints haven't actually been made. If they're received, they would go to a screening function within the college that would initially review it to see if it looked as though there may be a basis to think that the refusal to become vaccinated would give rise to some form of professional misconduct or some other issue under the Nursing Act. If that initial screen, they concluded there was a concern there, then that launches a very elaborate, very complicated regulatory procedure that could ultimately result in consequences for your licensing to practice controlled acts under the Nursing Act in Ontario. But in terms of how likely is that to happen, I just don't know because while some employers have threatened to make these complaints, we don't know what the college is going to say about that. The college has essentially been silent to the best of my knowledge. So it's something you should be aware of. It's something that you should be paying attention to. But beyond that, I can't give you a sense of what the risk is, other than to say that, you know, it is a very complicated, lengthy process that gets taken very seriously by the college. It's not just a trivial thing. And that if there are issues that are going to be raised with respect to your professional conduct due to these vaccination issues, it is a lengthy technical process that you would be involved in with the college that would frankly take quite a bit of time, I would imagine, to resolve.
Can I excuse my union from representing me and hire a lawyer to represent me instead?
No. So the way that labor relations works in Ontario is that once a union has been certified as the exclusive bargaining agent for a group of workers through the democratic process of certification, it is the exclusive bargaining agent for those workers. Workers don't have the right to individually opt in or out of representation. The workers have to be represented by the union. And the flip side of that is that the union then has that duty of fair representation. It has that obligation to represent all of the bargaining unit members. So you can't just decide I'm going to go it alone with my own lawyer. You can always retain a lawyer to give you advice. In the unionized context, there's going to be a very limited, if any, role that lawyer would play beyond giving you information and giving you advice. Really, the one exception to this that's important is when it comes to going to the Human Rights Tribunal. Individuals always have the right to file complaints at the Human Rights Tribunal if they believe that their employer has violated the Human Rights Code. It's an interesting area where the union is allowed to pursue violations of the Human Rights Code through the grievance procedure, but individual workers are also allowed on their own to go to the Human Rights Tribunal. The consequences for making that choice are complicated. If you're thinking about doing that, I strongly urge you to talk to your union, because they'll have to have a conversation with you about what consequences are going to flow from a choice to go by yourself. But that is the one kind of unique area in which an individual could decide to take some legal steps without the involvement, or at least without the direct involvement of their union.
If I'm terminated for just cause as a result of not being vaccinated, will this impact my pension?
Yeah. I mean, any separation of your employment is going to have very significant impacts on your pension. Exactly what those impacts are going to be, I can't give you an individual answer to that. It's going to depend on, your pension plan text. It's going to depend on some of your collective agreement language. But the bottom line is, yes, if you are terminated for cause, it's going to have a very significant impact on your pension entitlement. Difference depending where you are in your career, perhaps. I'm not a pension lawyer, so I'm glad that I can't try to give an individual answer, because I probably get it wrong. But the bottom line is, just like anyone else being terminated for cause, assume there will be a very significant consequence to your pension entitlement.
Paul, please go ahead. You're on mute.
Apologies for that. I accidentally hit the wrong button. I apologize for that.
You didn't mean to put your hand up? Okay, great. Moving right along then, I wanted to ask the next question. The directive speaks to medical exemptions. It does not speak to religious exemptions. So are we not entitled to religious exemptions?
Yeah, great question. And I think it's the biggest problem with the directive that's come out. And it's, I am surprised it didn't include at least the possibility for a religious accommodation. As I mentioned before, the Human Rights Code of Ontario says you can't be discriminated against in your employment with respect to particular grounds. One of those grounds is disability, and that is reflected in the minister's order. Another one of those grounds is something called creed. Think of it as religion and maybe a little bit more sometimes. And that's not reflected in the minister's order. The fact that it is not reflected in the minister's order, I don't think matters. The Human Rights Code is a special law in Ontario, and what it says is that if there is any inconsistency between the Human Rights Code and another law, the Human Rights Code prevails unless the other law specifically says that it takes priority over the Human Rights Code. In this case, the order that's been issued by the Minister of Long-Term Care was issued under section 174.1 of something called the Long-Term Care Homes Act of 2007. And the Long-Term Care Homes Act of 2007 does not say, with respect to ministers' directives under section what I just said, it does not say that those directives take priority over the Human Rights Code. So what does that mean? It means that the Human Rights Code takes priority over the directive. So to the extent that the directive does not include an ability to get a creed-based exemption, my response is, who cares? The Human Rights Code does. The Human Rights Code means what the Human Rights Code says. Now, I need to be very upfront with you. I suspect there are going to be relatively few individuals who will be successful in getting creed-based accommodations against this vaccination requirement. The law with respect to creed is very confusing. It's very difficult to apply sometimes. And given the current context, I suspect that most arbitrators and human rights tribunal vice chairs are going to construe this right relatively narrowly. But for those workers who do have a proper creed-based claim for accommodation, they have that entitlement. It is the law. And to the extent that the order doesn't respect that, I say that that's a problem with the order. And that's something that I think workers really should be pursuing in appropriate cases. Now, the reality is that because the directive doesn't talk about it, I strongly suspect most employers are going to be saying, oh, well, we can't consider a creed-based accommodation. And then that's a fight that's going to have to take place between the union and the employer, or between the individual worker and the employer at the Human Rights Tribunal. And it's not going to be a quick issue to resolve necessarily, but it's certainly one of those things where it's an issue that I think ought to be litigated, because I do think that there is a problem with the order to the extent that it does not specifically contemplate creed-based exemptions.
Thank you, Dan. Little break for you for a moment. Going to you, Dr. Moriarty, for a two-part question. If the vaccine is as safe and effective as all medical and health officials are saying, then why do we have to continue to wear masks and PPE after being fully vaccinated? And why now are they implementing random testing for fully vaccinated staff?
So that's a very important question. And so we know that the vaccines are very safe. They've had a really excellent safety profile. And that doesn't have so much to do with whether people would continue masking or being tested. But one thing that's important to know is that when you're developing vaccines, the first generation is usually designed to test for protection against the most severe outcomes. So all of the vaccines that we have were, the way the research was done was to count the number of people who got really ill and died from COVID when they were vaccinated versus unvaccinated. Second generation and later generation vaccines often will try to prevent transmission. So they'll try to prevent the spread of the disease from one person to another. But these vaccines that we have for COVID-19, they reduce the spread of the virus by about 70%. So they reduce it a lot compared to no vaccine at all. But they don't completely prevent spread amongst all people. So you can imagine in long-term care, you have a lot of people there who are pretty vulnerable to all kinds of different illnesses and infections. And especially elderly people often don't have fabulous immune systems, so they don't develop great responses to vaccines. And this is why, for example, it's been important to give a third shot to older people in long-term care. And it is possible that in this population, those vaccines won't last forever or just won't be quite as good as they would be in younger people. And so the reason that we still need to mask, the reason we still need to do all these things is especially to protect other people. So even if we're vaccinated, there still is a chance that we can spread COVID-19 to someone else. And so masking in that setting is especially about protecting other people that you come into contact with, who you work with, and that's why it's important. And so that's why, for example, there is random testing starting up again in long-term care to make sure that we're catching people who might have what's called a breakthrough infection. So they are fully vaccinated, but they can still contract the virus. And when you contract the virus, it gets into your eyes or your nose or your mouth. And for the first couple of days, it can still live there and your immune response starts kicking in, but it still takes a couple of days for it to fully clear it. When we're not vaccinated, what happens is that the virus spreads further down into our lungs, and it can get down there because the immune system isn't stopping it yet. When we're vaccinated, it stops it basically in your nose and your nasal passages and others. It doesn't get to go much further, so it doesn't make you sick, but you still have some of it there, and you can still share it with other people if you're talking to them, if you're close to them, and for reasons like that. So masking and testing people to make sure that they're not carrying the virus, even though they don't have symptoms, is incredibly important in long-term care because of how vulnerable the population is. And I say that as someone who both my parents, I'm a primary caregiver, both my parents, my dad was in long-term care for the last year of his life. My mom has dementia and is in care now. I was a PSW myself for 10 years. I understand how physically close people get in long-term care. I understand in dementia units how extremely difficult it is to keep people separated from each other. And so in long-term care, these measures are especially important because the people who live there are so much more likely to get sick, even if they're fully vaccinated, and so much more likely to die. And even things like locking down a facility so that people don't have social interactions at the end of your life, especially if you have dementia and you're not seeing your family all the time, is really, really difficult, as I'm certain that all of you know. And so for that reason, in long-term care, these measures are in place because it's such a high-risk environment for COVID.
Thank you very much. If I submit a notice of liability to my employer, will they be held responsible if I become sick or injured from the vaccine?
So these notices of liability forms, there's a couple of different ones that have been circulating around. You can just type them into Google and you'll certainly find a few different versions. They are legally meaningless. They have absolutely no legal consequences whatsoever. They are not worth the paper they're printed on. Feel free to distribute them to anyone you wish. It means nothing at all. So it cannot possibly change anyone's legal liability, whether or not one of these notices of liability have been given. It really is as simple as that. They are complete legal gobbledygook.
If I am terminated or sent home without pay as a result of not being vaccinated, will I be eligible to collect EI?
Yeah, that's a harder one. So to date, we're not aware of Service Canada, which is kind of the first level you deal with to apply for EI. We're not aware of them having rendered decisions, although that doesn't mean they haven't. It just means, the legal community hasn't really gotten our hands on them yet. Our best guess is that they're going to deny EI claims. But that said, there's every reason to be applying for EI anyway. There's a ground to be denied EI if you've kind of left your employment kind of voluntarily or of your own volition. Obviously, there's going to be a fight about whether or not you have voluntarily left your employment if you've been terminated for refusing to vaccinate. But my best guess is that they're going to say no, and I suspect that's probably where the case law is going to play out at the end of the day. But this is so new, this is so uncertain that I have a pretty low level of confidence in that. I think that's what's going to happen, but I could easily be wrong. And so, the advice I would give any worker is, even though I think you will be denied, you should still be applying fine, because you can't possibly be worse off for asking. So you should give it a shot. But I am pessimistic on your chances of success.
If I'm a member of the local union's executive and I get sent home without pay as a result of being unvaccinated, am I still allowed to fulfill my duties on the local union executive representing members?
Well, you're not allowed to go into the workplace to do work. So there may be a practical impediment to doing some type of representational duties, although in the era of Zoom, I would think that those would be less of a barrier than they may once have been in the past. So, unless there's some type of language in your collective agreement that's relevant to this, I don't see why it would be a huge impediment. On the other hand, if you've been, terminated from your employment for having not been vaccinated, you're no longer in the bargaining unit, and that puts you in a very different situation than if you were simply on a leave of absence.
If locals should fight creed-based accommodations due to the directive, how do locals make the determination as to whether or not the request is legitimate?
Oh, well, this is an easy one to answer. Hire me. No, I say that as a joke. That what I really mean by that is it's actually a really complicated question. Figuring out whether or not a particular claim for creed-based accommodation is or is not going to meet the legal requirements for a creed-based accommodation. You should really be talking to your national rep, or, for a lot of cases, I think realistically, you are going to be going out and seeking legal advice, although actually probably not from me at the end of the day. The reason I say that is because there's a lot of moving parts when it comes to a creed-based accommodation. I'll just kind of describe the two main ones. And as I talk about it, it may help you understand why it is a little bit complicated to figure these out. So I said before, creed is usually religion. It can be beyond religion, but generally speaking, it's understood to be about religion. The components of a creed-based claim are that, one, a worker has what's called a sincerely held belief that prevents them from, in this case, being vaccinated. Sincerely held beliefs are beliefs that a person honestly and truly has deep inside themselves. They don't have to be beliefs that other people of the same religion share. They don't have to be beliefs that religious officials approve of. The requirement is that they can't just be made up. So it can't be a belief that a worker who does not want to vaccinate is now pointing to in order not to be vaccinated. That's what it can't be. But as long as you sincerely believe it deep in your soul, that meets the first part of the test. And generally speaking, the law says that unless you have a specific reason to question a person's expressed sincerely held belief, you're supposed to accept it at face value. So again, if they've been running around and getting all kinds of vaccinations over the last year, and then all of a sudden said, oh, actually, I'm not allowed to be vaccinated ever. I don't believe I can. Maybe you have a ground to question that. But generally speaking, whatever they say their sincere belief is, you say, okay, that's your sincere belief. That's the simple part. The harder part is when we get to, well, creed. Because the other thing you have to do is connect that belief with a broader system of belief that meets the legal definition of a creed. And that's really where things get complicated. So a creed is defined as kind of this overarching system of foundational beliefs that go to the real core questions of human existence. Things like, is there a God? Or are there other planes of existence? Or what is the purpose of human life in the first place? What is my role in the universe? What is the nature of good and evil? It has to be a comprehensive system of beliefs that deal with those types of really basic questions. And it has to be part of a community of belief. So it's not just you saying, well, I have these beliefs. It's also, I identify with this group of other people who also identify as sharing those beliefs. And you may notice it's getting complicated here because I said that your belief doesn't have to be shared with others. Because it doesn't. You could have a strange, atypical, sincerely held belief, but you still have to connect it to a broader system of belief that other people do share with you. And how you draw that line can be confusing. I've told you that you have to accept a person's sincerely held belief at face value, and that's true. But when it comes to connecting that belief to a broader system that we're going to describe as a creed, drawing that connection, you don't accept a worker's say-so at face value. That worker has to provide objective evidence that's external to themselves that can prove a link between their belief and something called a creed. Very difficult how you assess these things. Very difficult how you go about exploring whether or not a person's belief system does or does not meet the definition of a creed. We do know that, things like, I believe that individuals should get to make their own medical choices, does not meet the definition of creed. People who believe in, well, I believe in science-based decision-making and I've done my own research and I've concluded that here are the risks, here are the benefits, and it doesn't make sense for me to get vaccinated. We know that does not meet the definition of creed. Those claims have been made at the Human Rights Tribunal. They have all been rejected. But in terms of, a more complex articulation of a system of beliefs, whether or not that is or is not a creed is a really hard question. And so, for locals, when you're approached by a member who is expressing a creed-based belief, my advice to you is to really listen, really pay attention to what they're saying. Ask questions, explore where that worker is coming from, and really try to tease out all the information about what is their belief, where does that belief come from, what is it connected to, so that you can get a sense of whether or not you think it might meet the legal definition of creed. And if it looks as though there may be something there, and maybe that you need to file a grievance just to preserve your timelines, but it's also something that you're probably going to want to talk to a staff representative or legal counsel about to get some advice about, really, does this claim have legs, or is it the type of sincerely held belief that really is what the person cares about deeply, but might not meet the technical legal definition of a creed under the Human Rights Code?
Thank you very much. Our local union has stated that they cannot file grievances for termination for cause. Is this true?
I'm not sure why they would say that. You under any collective agreement I've ever seen, you can grieve a termination for cause. It may be, for example, that some of the emergency orders that are still at play. Remember when the pandemic first started, the government started invoking some emergency powers. Many of those applied to the long-term care sector, and some of those powers allowed employers to do what's called suspend the grievance process. That doesn't prevent unions from filing grievances, and there's actually case law out there that says that it doesn't prevent those grievances from being pushed forward to arbitration in most circumstances. So, to the extent that there are local leaders on here who think that they are for some reason precluded, definitely talk to your national rep, because the chances are, I think you may be laboring under a misunderstanding about the current state of play when it comes to grievances in long-term care.
Dr. Tara.
I'll just quickly add on to that to say, on behalf of any worker who's terminated, even workers who do really dumb things, not connected to vaccination and not connected to this stuff, the tradition of our union has been to file grievances to try to protect that worker as much as we possibly can. It's part of our duty of representation. Talk to your national representative directly, get advice directly. And if you have a concern that you somehow are being told that that won't happen, then you need to ask why, and you need to seek further clarification from our union.
Dr. Tara, one member has said, well, after 6 months, the vaccine is no longer effective anyway, so why force people to take it?
Oh, so that's a really common misunderstanding of the vaccines. So certainly, I was talking about long-term care, and I was talking about people who are quite elderly and don't have great immune systems to begin with. What we've seen is that some people who are quite elderly, who've had the vaccine, it's still working, but it's fraying a little bit. It's not working quite as well as it did over an extended period of time. So at this point, vaccinations started in long-term care and the most at-risk people about January, late December. We're at about 10 months now. we're seeing some decline in the efficacy of these vaccines, or the effectiveness of these vaccines in this population. But it certainly is not true that they don't work at all. They're just not quite as good as they were back in, February, March, for example. So one of the things that it's beginning to look like is that it's possible, like many other vaccines, that this may be a 3-shot vaccine. Ultimately, you tend to see this in older people first, where you need a 3rd shot to really maintain the immunity. We're not sure yet. There are no really obvious signs, but it's starting to look like this may be something where we may all eventually need to get a 3rd shot, just like so many of the vaccinations that those of us who work in healthcare settings and research settings are required to get. So they do still work. They still work better than what our wildest hopes and dreams were back in November of last year. We were hoping at that point that we would get vaccines that would be 40 or 50% effective, and these vaccines are still far higher than that. We hit an absolute home run, and we were extraordinarily lucky. And they are probably, we may end up needing a 3rd booster at some point, but generally the protection still is very good. And what's important for everyone to remember is that none of this is absolutely black and white or absolute, right? So we use layers of ways to protect ourselves and other people. One of the most effective protections there is vaccination. But if you add on top of that masking, for example, or distancing, or not sharing closed spaces with shared air for too long a time, each of those individually provides protection. And when you combine them all together, it provides a lot more protection. And so that's why first of all, it's not true that the vaccines don't work at all and that they stop working after 6 months, but even if they are, 10%, like if they're reduced in their effectiveness by a little bit, still in combination with other measures, they're highly effective. And you can see that when you look, when you look at who the most serious cases are in Canada. It's primarily among unvaccinated people. And the last thing I actually wanted to tell people is that one of the areas that I really specialize in is estimating the impact of COVID-19 in Canada on deaths and serious outcomes like ICU admissions and hospitalizations. And what we can say right now is that among all the people who've been fully vaccinated in Canada, there have been about 330,000 lives saved by vaccination. These are people who would have died if they had not been fully vaccinated. We know that all of us are going to be exposed to this virus in the next year or two, and there's still probably about 30,000 people in the country who could die. But what we do know is that these vaccines have prevented an enormous amount of death and hospitalization. So they're highly effective. They have changed all of our lives. We will slowly emerge from this. I think it's going to take a long time. I think it's still going to take a while still, but they are one of the most important things that we've had to be able to deal with COVID. And it's one of the most important things for our society to be able to move on.
A constitutional lawyer has said that if your employment is already underway, it is illegal for an employer to impose a new condition not included in the employment contract.
So no, that's not correct. And it's important to recognize that there are important differences between how the rules work for unionized and for non-unionized workers. And so, unless people have snuck their way into this webinar, I'm going to go on the assumption that everyone here is unionized. And so those are the rules that you should be aware of and care about. So When it comes to what the rules are and the terms and conditions of your employment, your collective agreement is really an important place to look to figure out what those rules are. Your collective agreement is going to set out a lot of rules that your employer is absolutely required to comply with, and they're not allowed to change what those rules are, although given the emergency orders, there's sometimes they actually are relieved from their obligation to follow the collective agreement. But in general, your collective agreement will set out all kinds of rules about what it is that your employer can and can't do, and they're expected to follow that. And they can't just say, you know what, the collective agreement says that you get 3 weeks of vacation, but we're only going to give you 2 now. That wouldn't be allowed because your collective agreement sets out that rule. There's also going to be a huge amount in your collective agreement, there's going to be a huge amount of rules in your workplace that's not covered by the collective agreement. And this goes to something called management rights. So basically every collective agreement has a management rights clause that it says, as long as it's not conflicting with the provisions of this collective agreement, the employer maintains the right to govern their workplace as they see fit, so long as they do so in a reasonable manner. And what that means in practice is that there's a lot of law that labor lawyers have to litigate about, well, just how far can an employer go? But the basic answer is that if your collective agreement doesn't specifically say your employer can't do something, then they can impose a new set of rules on you without your agreement and without the union's agreement. They can impose those new rules on you as long as it's done in a reasonable way. So, early on in the pandemic, many workplaces began to impose new rules on workers that they had to undergo antigen testing as a surveillance system in their workplaces. In Ontario, there have been 3 cases that have gone forward to labor arbitrators challenging that, saying that that's just an unreasonable exercise of those management rights. They can't change the employment rules without our agreement. And in all 3 of those cases, labor arbitrators said, yep, they absolutely can. It is a perfectly reasonable exercise of their management rights to impose a new requirement on workers to undergo rapid antigen testing as much as 3 times a week. One of those was in the long-term care sector, and we all know that you were subject to a ministerial order that imposed some of these rules, but it also applied to other sectors like construction and food processing, where there was no government requirement. So it is wrong to suggest that your employers can't impose any new rules on you that you haven't agreed to. That is dangerous misinformation that I think could put workers in danger of being punished by their employers for insubordination. If you are concerned about new rules that your employer has put into place because you think either they conflict with the specific language of your collective agreement, or because you think that it is an unreasonable new rule, you should be talking to your union, because there are things that can be done to challenge improper new rules. But it is simply wrong at law to suggest that an employer can't change the rules of your employment at all once there's a collective agreement in effect. That is not the law. And if you act as if that's the law, you are exposing yourself to a significant amount of risk when it comes to your employment. So definitely talk to your local, talk to your national rep, get advice about what they can and can't do. Their rights are not unlimited, but they certainly can impose new policies. And in the context of COVID, they have done so, and those changes have been upheld by adjudicators as being lawful.
How is it fair or reasonable that long-term care workers are being subjected to potential termination while family members and caregivers are able to enter the facility and visit their loved ones and have to have no proof of vaccination?
Yeah, an entirely fair question. And you know, for those people who see that situation and say that's not fair, that's not just, you'll hear no objection from me. I'm not there to defend that choice. But as I said when I started, I can't tell you what's fair or what's unfair. You know, I'm a lawyer. I wish my job was about fair and unfair. My job is about what's lawful and unlawful. And so the question that I can answer is it unlawful for the employer to impose one set of rules on its workers and impose a different set of rules on visitors? And the answer is no, it's not unlawful. And in fact, if you go and you look at the orders that long-term care homes are legally required to comply with, because the Minister of Long-Term Care has ordered them to do some things, they actually have an obligation to apply different rules to different sets of people. So it may be profoundly unfair, but the law compels them to do that. They don't even have a choice about that. They are subject to the regulations under the Long-Term Care Homes Act, and the minister, for whatever reasons, formerly she, now he has imposed certain rules, and they, as long as those rules are in place, long-term care homes will be complying with them.
Am I better to quit to protect my pension than be terminated?
So I'm not going to give individual pension advice in this context. That would be extremely dangerous. If you want to understand what the specific consequences for your pension is going to be, you need to talk to your union and your national rep, because that's advice that you really need to get on an individualized basis. You shouldn't be trusting this type of generalized discussion to give you advice on that very specific question. That's something that you're going to have to talk to someone about and discuss your own unique circumstances to know what's the best option for you.
Final question going to you, Tara. There's still so much conflicting medical evidence and science out there that suggests to us that the vaccine isn't safe. I'm still afraid to become vaccinated. I'm at risk of losing my job. What should I do?
So first, my feeling is for you, because obviously you're very afraid of the vaccine, afraid about making a decision that's not good for you. What I can tell you is, if you have any questions, any and all of your questions, come to our drop-in sessions, and we can go through every single one. We can talk about every single thing that you're concerned about. There is a lot of conflicting information, but there's also an enormous amount of misinformation out there. And it's a big concern, right? Because it means that people may not be getting good advice, or they may be hearing things that in fact aren't true. So what I can tell you is that in our organization, the volunteer scientists and doctors and pharmacists who do this, we're there for people, and we're there to make sure that every person has someone like that they can access and talk to and get information from. Not all of us have pharmacists, doctors, and, in our families, right? We're all there to make ourselves there for anyone who wants to talk to us the way they would if that person was part of their own circle. So all I can say is, I'm so sorry that you're going through this right now. I'm so sorry that this is such a decision that is so fraught and is worrying you so much. And all I can say is that I and others will be there to listen and provide support and information to you. No question is too small. No question is stupid. No question is unimportant. And we all understand protecting other people. We all have had family members and others who have felt like this that we care about a lot. And we are there to provide that support for people. So I would say just come to the sessions. They're available a couple of nights a week, and we're there for you. And you can talk for as long as you need to about this, so that you feel like you have confidence to make a decision that's good for your health and good for you. And I'm so sorry you're going through this.
Okay, thank you very much. Dan Shepard, our legal expert from Goldblatt Partners, Dr. Tara Moriarty, an infection disease scientist at the University of Toronto, Paul Sylvester, our health and safety officer, Fred Hahn, the CUPE Ontario president. I want to thank you for joining our panel this evening and providing your expertise. But to all of the members who joined us today, we hope that you found this helpful and useful. The recording of tonight's session will be uploaded to cupe.on.ca/vaccine policy info. This recording will be available to share with anyone who needs to see it. And again, just want to thank you for joining tonight. And if you are impacted by this directive that's going to be coming into place, contact your local union, contact your CUPE National Staff Representative. Your union will be there to defend you and to support you however we can. So please reach out and know that CUPE is here to support you. Thank you so much, everybody, and have a really great evening. And thank you for joining us.